Hello, this is Erik Dalton, and I'm here with Everin. Say hi, Everin.
Hello.
This is a routine I'd like to show you that I start every session with, no matter what they come in with. And I've been teaching this for decades, so a lot of you have already seen it. We're just going to do a little bit of mixing it up a little bit here. I'm starting with the unilateral neck stretch, and I come in with my left hand on her forehead, and I'm just going to drape this hand softly around her neck here. But the main reason I'm starting with her supine in this position that's very, very comfortable is because I like to look them in the eye and make contact and get this bond going. We've already done it in our history intake. We've already communicated and made sure that they are fine in the environment that we have them in, and now we're going to make that bond on the table. A unilateral neck stretch is one of the best ways to do it because it's comfortable and it also gives you a lot of information. So I'm just leaning, notice how I'm leaning my body weight back. Do not get in and do this stuff. No bicep work. You're leaning in and just dragging the tissue, but you're also seeing, how does that cervical spine spring? Do you have spring in your cervical spine? You know, we're supposed to have a cervical lordosis. Is there spring in the cervical spine, particularly around C4-5? So I'm going all the way up to suboccipitals, slowly just dragging. Notice how the left hand is pushing away while the right hand drags back. You can even rotate them all the way over and get a little bit more of a drag there. Of course, I would do this on both sides, and if your fingers are long enough, get down into the thoracics, get up into T1, T2, and then drag up. Feels so good. How's that feel?
Great.
She's got a little bit of a problem, she was telling me, on her right side when she works out. Get some pinching in her subscapular area, you know, probably coming from the neck up here, I would say. We're going to check that out in a minute. So unilateral neck stretch, do it on both sides, obviously. Warm up the tissue. You're evaluating for how the vertebrae are moving and how much cervical lordosis you got in there. Will that spine spring? Next thing we're going to do one that's been around for a long time, and you all already do some version of it. Doing on this side here. It's, they call it the velvet glove, but there's very different ways to do it. And this is the one that I prefer. I like to cradle the head like this. You can even get your body in close if breast tissue isn't an issue. In all of these techniques, if breast tissue is an issue, get you a small pillow. Put it there. Always, you know, make yourself comfortable. So I'm going to get in here with a soft fist, right in here like this. Notice how I have her down, and as I lean away, I'm always leaning my body. I'm not muscling them, I'm not pulling, I'm leaning my body. As I lean my body, I drag down. All the way in, rotation and side bending occur to the same side in the cervical spine. So anytime you rotate the neck, you're also side bending the neck. That's called neutral mechanics in the cervical spine. Pushing those traps down. Levator scapula, upper trapezius. They're always pulling those shoulders up and pinning them back. A lot of tension there. We know that already. Decompress a little bit. Always decompress when I'm doing neck work, particularly when there's rotation. Now I'm going to sit down. Sometimes I do this standing, sometimes I do it seated for camera purposes. I'm going to do this seated. This is a routine I've been doing for quite a while that, hold this please, that you may or may not have seen. We're going to start with chin jutting. So my thumbs are going to come right in here and push against in the lamina groove, against the bodies of the spinous processes. And all I'm going to do is just push up, push up. It's causing the vertebra to have to try to close, try to put that curve. I'm still thinking restoring cervical curve. Those with the forward head posture, what do? They lose cervical curve. That's what's going on, the loss of cervical curve. So we're going to go in here and chin jut first. Then next I'm going to have my thumb, one with my bane in the drawer, right in here on the groove, and I'm going to side bend my body to the left while I push on the bodies of the spinous process. Randomly up and down, C7, all the way up to C1, C2. C7, T1 to C1, C2, all the way down. First of all, I'm just going to do it unilaterally so you can get the idea, just pushing on the bodies of the spinous process. You can come in with fingers and do this too, and you can come in with a flying V that I'll show you, depending on how strong your fingers are, how mobile your thumbs are. All right, so the first thing we're going to do is chin jutting. So I'm getting right in here, and the biggest problem I see in practice is people don't get low enough. They don't get under. You got to get under. The chin has to come back. Notice when I push like that, my whole body's going forward. Watch your chin. It's my whole body. I'm not doing this, right? Whole body movement. So I just come up randomly, comfortably, rhythmically. Body work is about rhythm. Rhythmically up and down, chin jutting. Assessing for art, asymmetry, restriction of motion, tissue texture abnormality, art. It's an old osteopathic term. We've been using it in musculoskeletal alignment techniques for 3 decades. So I'm feeling a little bit of restriction on the right side, and so I'm going to hang out here a minute and just do a little bit of chin jutting. And now I'm going to side bend to that side and take this hand off just so I can side bend over there, and then I'm going to show you when I come back on how it goes to the left. I'm going to be back against the spinous processes, and then I'm just going to side bend over those spinous processes. You can do it one-handed, or you can go back and forth like this, randomly up and down, all the way down C7T1. How's that feel?
That feels really good.
Ida Rolf would have said, I must be doing something wrong if that feels that good. Okay, so side bending, and then there's translation. Translation is the same exact positioning of your hands, hold this please, except this time you're just going back and forth with your body, and when I step with my right foot in side bending, I push with my right thumb, left thumb when I go to the left. Just the opposite in translation. When you lean to the left, you push with your right thumb. Lean to the right, push with your left thumb. What that gives you is that Egyptian thing where the head staying in the same plane. So the head should stay in the same plane. The eyes should be level and all that stuff. So that's translation. There's not a lot of movement in translation, but any minor movements that are lost are significant. So here we go. Left, notice I'm leaning to my left, but I'm pushing with my right thumb in that same position I've been in the lamina groove, and then to the opposite side. So our head is staying in the same plane. I'm just going back and forth, assessing for something that may not be moving, or multifidus rotatory spasm in the deep layer muscles. Maybe semispinalis sometimes will have some protective muscle guarding in there, particularly in cases where there's pinching like she's having. But I'm not feeling that right now. Back and forth, back and forth, back and forth, back and forth. Okay, this last one is called undulation, and I just wrote an article about this. I call it the alligator sway, because it's that motion that we just discussed where the head is staying in the same plane. You're going back and forth with the head in the same plane. See how her head's staying in the same plane? But here's the thing, it's all about rhythm. Button the elbows against the body, getting the head, center of gravity low, sumo wrestler position with the belly out, really, really comfortable, nice, comfortable hand position, cradling the head, and then all I'm doing is leaning my body weight to the left. I'm actually pushing with my right hand. Neutral, right, neutral, left. She's got a little guarding in there, a little protective muscle guarding. When I go to the left, she doesn't like to go to the left. Left, so I'm going to take it easy. I'm not going to bulldoze that barrier. Neutral, Right, no problem, right. Neutral, a little better. Neutral. Okay, so here's where you want to go with this. You want to get it rocking and rolling. I actually had this done by John Upledger Sr. to me, version of this, on a table in a demonstration at his, at a conference. And he was able to rock me all the way down and say, you've got a problem in your thoracic vertebra. How did he know that? Because he's rocking that vertebra all the way down, the spine all the way down to that, and when there's fixation, he could feel it. That's talent. Okay, so we're going to do the same thing. Here we go. Ideally, you'd like to get it rocking all the way down to the sacrum, but that sometimes is not possible. Alligator sway. You're going back and forth like an alligator, that undulating motion that a lot of reptiles have. She's starting to loosen this up now, going to the left.